Hey guys, I just want to do a quick review of our discussion from this past week on manual therapy for folks with neck pain. I think you guys all did a really good job presenting an example of a person that you worked with that had neck pain and you applied manual therapy and describing your reasoning. A big part of improving yourself as a professional is doing a bit of self-reflection where you think about your thinking. It's also called metacognition, and describing your reasoning. And this was a perfect opportunity to apply some of the readings that we selected for you guys on manual therapy. So I think some of the topics that came up, of course, manual therapy was sort of introduced into a more purely mechanical model, where you're either putting something back into place or you're freeing up this joint or that or improving stiffness in this region. And what the research suggests is the mechanical effects, if there are any, are fairly transient. And really what it comes down to is more the effects of the modulation through the nervous system. And then, of course, the non-specific effects, particularly we discuss patient expectations. The good news is that sort of opens us up to using a wide variety of different techniques with our patient that we can really either tailor to the patient, tailor to our own skill set. It really doesn't seem to matter that much. I can remember learning manual therapy and thinking, feeling kind of overwhelmed because I didn't have the skills, or I didn't know how to assess the patient correctly in order to apply the correct technique. But at this point, I think we can safely say that a wide variety of techniques seem to be beneficial. You can kind of tailor it to the individual patient, talk to them about it, ask them about their expectations, collaborate with them as to what they would hope to get out of their PT session, and if you're going to apply hands-on techniques, offer a variety of different techniques that they might be open to. So that makes it a more patient or person-centered treatment session, less just directed by you, and it also takes some pressure off you to try to figure out what is the exact treatment that's going to work for that patient. And that's kind of what the research is showing. You can treat the thoracic spine, the cervical spine. You can mobilize, you can manipulate. There's so many different avenues out there. When we do our weekend course, so of course we're going to be practicing and learning and sharing different techniques, which is great and a lot of fun. But always we want to come back to keeping the patient at the center, remembering that the mechanisms of manual therapy are largely modulation through the nervous system, so you don't necessarily have to follow complex or complicated biomechanical rules. And really, remember, collaborate with your patient, understand their expectations, and keep it patient-centered. Thanks, guys. I look forward to this week delving into a really interesting topic, which is going to be cervical radiculopathy, nerve root disorders. Hopefully the readings this week will stimulate some thinking, maybe some things that you haven't thought about before. Thank you.